can you talk to us a little bit about what you're seeing with synthetic opioids and fentanyl usage?
Well, that's really been a game changer
Has it
over the
not?
last 2 to 3 years. I've been seeing almost all of my opiate detox patients coming in with the urine drug screen showing fentanyl only. The pure heroin that was from poppy seeds from either Asia or South America has virtually disappeared. It's been replaced by the much cheaper and stronger fentanyl. Uh, Fentanyl somewhere in the neighborhoods of hundreds of times more powerful than heroin. Certainly depends on how it was manufactured, what it's cut with, what the other inert ingredients are as far as how strong it is. The big game changer we've had is withdrawal can vary in the length of time when it starts. I had a much more predictable out of my training. I knew heroin addict, about 12 hours. I knew the withdrawal was going to start. I knew I could start my detox medications. We had a track record of 50 years of treating those patients. Fentanyl, different. I can't predict when it's going to start. We just had a patient the other day that I started on detox medicine on the 4th day, and it was still too early. The patient was sick, but fentanyl lives in fat cells. It hangs onto the brain receptors very erratically, and when you give the medicine, it causes a phenomenon called precipitated withdrawal. So this young man got very sick. We had to use some other medications, give him some sedation. He's fine now, but it complicated it. Not to mention the opioid crisis in the United States basically falls down to fentanyl and the accidental overdoses, as people call them. People may have meant to use opiates or they may not. Opiates are now in cocaine. They're now in fentanyl. They're now in cocaine on occasion, now in methamphetamine, even cannabis on occasion. Even the illicit Xanax bars that are pressed may have fentanyl in them. So I always tell my patients the quality control in the illicit drug world is not there. There is no quality control. They just move product.
Yeah, absolutely. And patients don't know before you can ask an addict what their dosing was, what their dosage was that they were taking. Now with fentanyl, that's completely different. Someone may have thought they were taking an opioid. We test them and fentanyl shows up, and you can see the look on the face of someone who really did not know that they were taking fentanyl when you present them with the positive results from fentanyl. So
exactly.
That's something for people who are using street drugs to be aware of, and for families to know that that is a reality of what's happening. And we're seeing it on an ongoing basis, almost with every patient that comes in with street opioids that they're taking. Like you said, it's even in marijuana, which I think a lot of people don't realize.
No, they don't. Many, if they're stimulants like cocaine, methamphetamine, or benzodiazepine, as I said, the pressed pills, the Xanax, if it spills over, there may be fentanyl there. As likely as not, they're very surprised because many will say, I never did opiates. Opiate wasn't my thing. Yes, right. There's fentanyl in their urine.
Right. How do you think, or what do you think is one of the best way to educate loved ones about talking to someone who they know in their family has an addiction and maybe hasn't come to them and said, yes, I need help yet? Do you have any advice for those loved ones?
The advice I always give the families is treat this the same as you would if you suspected they had cancer, if you suspected they had heart disease, if you suspected any, as this is emergency medical problem, treat it the same way. And, whatever your relationship is with that family member will dictate how far you're willing to go. Maybe you think they're having a heart attack, you can't get them to go, and then you go on home if that's the relationship. But I don't think it is for many. Many on this one, the patient who's addicted will fight to the end because they're of the fear. They've all probably already started the withdrawal process. They're very scared. We know their decision-making process in the brain through the prefrontal cortex is not working properly. So the decision they're going to choose is not the correct one to use again. It's inevitably the one they use. So my approach to interventions is intensity. I don't know that you would necessarily call it tough love, but I basically tell families, don't take no for an answer. You know, I did interventions for a few years while I was out of medicine myself, and one comes to mind to me. I did an intervention on an alcohol patient back in Alabama. The family had me come over. We read letters to him. The families talked with him, and he politely just declined our invitation to even go to a rehab for evaluation. So when he left, the family asked me, well, what's our next step? And I said, well, the next step is going to depend on just how you feel about this, how important he is to you. I said, you've told me he drives intoxicated. They said, well, yeah, because he drinks every day and he drives. I said, well, you need to call law enforcement. They said, we can't do that. He would never speak to us again. I said, this man has alcoholic cardiomyopathy. Very soon, he's not going to speak to you again anyway. So that's when the tough decisions have to be made. And I guess that is tough love. That, okay, we're gonna get law enforcement involved, either arrest you for a DUI, or many states that have Marchman Act or some version of involuntary commitment, at least until you can get an evaluation by a medical professional. I'm not saying take away anyone's rights by any stretch, but this is a time period in your life you cannot make good decisions. So you need the help. And I just tell families, don't give up on that intensity. Approach this the same as if you would a heart attack. And you wouldn't take no for an answer and let that family member just go back and sit in the lawn chair or sit on the couch. You call 911 and get something done.
Right. I think that's wonderful advice. I had a situation last night with a potential patient, and the son became angry with the parents. He left in a rage, and they were afraid that he was drinking and driving. I talked to them later on, and the mom was very upset. He had been arrested for going through a stop sign and stopped. And I said, that may seem horrific now, but you don't know what that could have stopped. That is something that you cannot reverse. So that can be a blessing. That can be a wake-up call for the person that's addicted. That can scare them into recovery, because most times addicts realize that they need help. They realize it maybe before they're going to admit it, what I have found. And whenever you speak to them and you talk to them about how you can help them through the withdrawal, they're much more apt to sign up for getting treatment and going through a recovery program than they would if they thought they had to go through that withdrawal phase by themselves again.
Exactly. And you are right. They are looking for relief because life is miserable in active addiction. They just don't know what path to follow to get that relief. And quite often I'll have patients, the first time I interview them, I don't make the interview all about me, but they say, you have no idea what I'm going through. And then I usually give them a copy of my book, and I say, yes, I do. I went through this many, many times before I finally got it. That helps many of them, just hearing the empathy from my part that I know what they're going through, and I'm going to do everything I can to keep them safe, number one, and comfortable, number two.
Right, right. Well, I wish we had longer to talk, but I think we could do this again after we show this. I'm sure there'll be a lot of questions, but I can't tell people enough. This isn't a plug for your book, but honestly, we keep it here at our clinic for every person that's going through recovery. We offer it to them to read and also suggest it for family members. I think it's a must read for anyone that has been affected by addiction in any form. So
thank you very much.
Yes, I mean, it's absolutely wonderful. And I would like next time for us to talk a little bit more on the parts that you have in the book about the length of recovery time for the brain, the frontal cortex, address some of those issues that you so wonderfully describe and talk about in your book. I would like to do that next time. So thank you for taking time out of your schedule and joining us. And we look forward to talking to you more.
I look forward to speaking with you too. Thank you.
Thank you. Bye-bye.
Bye-bye.